part 5 of how to be an art therapist in a mental health facility. So today I wanted to talk about materials, what you should absolutely never use working in the type of facility that I work in. Starting with the obvious, we'll just talk about sharp objects. So that could include scissors, even go down to pencils, pens, anything with a sharp point, anything that can do some damage, toothpicks. Did you know pipe cleaners? Just think of all the things that potentially could harm you. Those are off limits. You cannot use anything like that. So you have to improvise. So for me, instead of using scissors, what I do is I use a ruler. Also, you cannot use a straight edge ruler. I actually have those flexi rulers, but they do work pretty well. And tearing paper, you just line it up and then you tear the paper along it, and it does work pretty effectively. Number 2, anything toxic. So we're talking glue, certain glues that have odor to them, alcohol markers, alcohol ink. So some of those are my favorites to use actually on my own, but I would never use them in a mental health facility because of the toxicity. So just think of anything that has an odor to it, anything that ingested could be toxic. Those are completely off limits. Next is anything breakable. So you can't use anything like glass, even any like plexiglass or plastic sheets, things like that can be broken. And think of the sharp edge, again, can be used as a weapon or in self-harm. String, yarn, anything of that, can't use that either. Things can be tied around things, circulation cut off, you get my drift. So nothing like that. So you have no knitting, no weaving, nothing. That's why I used paper in my weaving a few weeks ago, if you remember that video. So yep, can't use that. That means no beading either, which is to me such a great activity for art therapy, and I have used it in private practice, but that is a no-no in a mental health facility. Another one is small objects. So talking about like the beading would be one of them. Doing mosaics, like little tiny tiles, those little googly eye things, shells, like if you wanted to use seashells to do some kind of a collage thing, anything tiny, even down to like glitter. Now, glitter is my own personal hatred, and there's haters out there, and there's people that will hate me for it, but glitter should be outlawed. That's just how I feel about it. It is a cleanup disaster. But anyway, so things along those ends, sequins, you just really want to avoid those with your groups. Heavy or hard objects, that includes like stones, which are kind of also really cool to paint. You would use those maybe in private practice or just in a more contained setting, but you know, you can't use those. Anything like a slate that you would maybe paint on or create on, nope, can't do it. Last but not least would be anything flammable. So of course, you're not going to have matches on your unit, but you just never know what could cause a fire, so you have to be super careful. And let me just share this with you. I used to have all of my patients' artwork up in the group rooms, and I had adhered it to the walls. Some was tape, some was like the glue, tacky glue, and that is considered a fire hazard, which I learned. So all of it came down. Anyway, so those are just some tips and tricks in what materials never to use if you are an art therapist in a mental health facility. Tune in, I got more. I'm Jean, and I'm an art therapist.